Hi there. Good to meet you. I'm Dr. Blue. Thank you so much for agreeing to meet with me like this. As you know, given the current health situation, we've decided that all pre-surgery visits should be done via telemedicine. So, welcome to my home. Thank you. Yes, your surgery will go on as scheduled. We just want to minimize your time at any health facility. That's why we're doing this. So since your surgery is just a few days away, I thought that we could go over a few things. As your anesthesiologist, it's very important for me to make sure that I have a full and clear understanding of your medical history so that I can ensure your comfort and, most importantly, your safety throughout the entire procedure and then afterwards. Do you have any questions before we begin? No, you should not feel a thing. You will be completely out. While we in the medical profession don't like to make promises or guarantees, I can tell you that your operation is a very common one. Yes, and your doctor, Dr. Bellucci, she performs several of these procedures every week. So you are in great hands, full of very capable professionals. Have you enjoyed working with Dr. Bellucci so far? She's great, isn't she? So intelligent and so kind. Yes. Yeah, I do many. Yes, I do many procedures with her every month. Great. I'm so glad to hear that. Any other questions before we get started? None? Okay, great. So why don't you just confirm for me your first and last name and your date of birth? Uh-huh. Okay, great. That's what I have. Yes. Okay. And why don't you tell me why you're having this procedure done? Uh-huh. Sorry if I'm looking down, I'm just looking at my notes and my files. Okay, great. And how long has that been an issue for you? Okay, so quite a while. Well, hopefully this will fix the majority of your symptoms and you will be right as rain as soon as it is over. After recovery, of course. Okay, great. So tell me, have you ever been put under before? Just once? Okay. How old were you? Okay. So a little while ago. Great. Okay. Sure. Yes. And did you have any complications with that? None? That's great. Hopefully this will be just as easy for you then. Right. Yes, so my job is to make sure that you stay under and out and comfortable for the duration of the procedure. How long will it be? It depends on the patient, but your doctor, she typically finishes in about an hour, 2 max, typically. Although you never know in an operating room with each patient being different. That's right. Yes, I think this will be... Oh, go ahead. Sure thing. Okay, perfect. Can you tell me anything else about that procedure you had? Oh, okay. Perfect. How long have I been doing this? Well, I've been in school my whole life, but I've been at this hospital for 9 years now. Yes, quite a while. I have been the anesthesiologist on many of these types of procedures. So, I think you're also in good hands when it comes to me. Yes. Now, are you allergic to any medications? Okay. Yes, that's very common. And that should not affect, right, that should not affect my job in any way. Anything else? Okay. Now, will you be bringing anyone with you to the procedure? Wonderful. Okay, so I know that they've probably told you this, but make sure that you have someone to pick you up. You may have to stay one night, depending on how you react to everything and your pain levels, but we don't want you to be able to drive yourself home. So make sure that you have someone there with you so that they can take you home. If not, the hospital can always call a taxi or an Uber. We also work with several private driving companies, so we just want to make sure that you get home safely and that you can rest from there. Right. Perfect. Is there anything else that you'd like to add? Any other questions you have? Oh, sure. Yeah, I'd be happy to go over that, no problem. Okay. Oh, you read up on it a little bit? Well, be sure not to trust everything you read online. Of course. Yes. So you will not be able to wear your contacts during the procedure or glasses. So if you're nearsighted or farsighted or have any other vision issues which require contacts or glasses, you may not be able to see completely clearly before I put you under in the operating room, but you won't really need to. And especially now that we've met, you know the sound of my voice and you will be able to follow any directions I give you, but it's pretty easy. We're just going to have you lie on one side, most likely your left side, with your knees together. We'll give you a little pillow to put between them, right? Yes. You'll only be in there for just a few minutes while the nurses are finishing setting everything up, and your doctor is finalizing all of her tools and instruments, making sure she has everything ready to go. Right. So really, you'll only be aware and awake for just a few minutes before the procedure begins, that's right. Yes. If you want to wear your contacts to the hospital that morning and then take them out, just be sure to bring a container and some solution. That's right. Yes. No, it's not a dumb question at all. I myself wear contacts, so I can understand it can be a little bit disorienting not to be able to completely see everything, but actually it might make you a little bit calmer because you won't be able to see instruments or read numbers or anything like that. You can just float, peacefully. Someone will wheel you into the room. You'll already be on your hospital bed, and we do the surgery with you on that bed, of course, with sterile equipment. That's right. Yes. Okay. Great. So if you don't have any other questions for me, then I will see you on Tuesday, right, for your procedure. If you have any questions at all, you can feel free to email me with your Health Connect account. I know that you previously set that up. That's right. I check them several times a day, so if you have anything else for me, I'd be happy to get back to you. Great. It was so nice to meet you. And thank you so much again for agreeing to this virtual visit. We're just trying to minimize everyone's chances of exposure to anything. And this has been pretty efficient. Right. So thank you so much, and I'll see you soon, okay? Just take deep breaths. It's natural to be nervous, but we do this all the time. Great. Thank you so much. Nice to talk to you. Bye-bye.